Hello everyone, today I'm gonna be talking about polycystic ovary syndrome, or what we call PCOS. It's a hormonal disorder defined by a group of signs and symptoms. PCOS affects nearly 7 to 10% of women of childbearing age, and it's the most common cause of infertility. But actually, many women do not know they have it because it can be silent. Symptoms and signs of PCOS, hormonal disorder, including high concentrations of male hormones, elevated testosterone, which is one of the male hormones. Also, clinical signs of excessive male hormone like acne, hair on the face, and thinning of the hair on the scalp. Also, problems with ovulation, irregular or absent menstrual cycle, and infertility. What are the health conditions associated also with PCOS? Many women with PCOS have decreased sensitivity to the hormone insulin, the hormone that regulates blood sugar, and this can lead to insulin resistance and a major risk factor for type 2 diabetes. Women with PCOS often have type 2 diabetes and associated with overweight or obesity, especially the accumulation of fat around the waist. And that can lead to cholesterol disorders and fatty liver. Also, it's a risk factor for gestational diabetes. Because of the irregular cycle, women they lack ovulation, and the lining of the uterus may not shed every 3 months, and that can lead to endometrial thickness or even endometrial cancer. So how is PCOS diagnosed? It's a clinical diagnosis based on physical examination and hormonal profile with ovarian ultrasound. Hormonal profile can be ordered by your doctor, like checking the hormone level in the blood. The ultrasound of the ovary will show large ovaries with many small follicles on the peripheries, and this is why it's called polycystic. However, these follicles are not cancerous, they are benign. So how is PCOS treated? There is no curable treatment for PCOS, but usually we treat the symptoms. We use certain medications, but before that we try the healthy lifestyle to achieve weight loss. Medication sometimes we use to like birth control pills, because it's a hormonal medication that will regulate the cycle and decrease the concentration of the male hormone. Other medication, we have medicine that will block the male hormone action on the hair, and that will decrease the excessive hair growth. Of course, we use medications that will improve insulin sensitivity, the same medicine that we use for type 2 diabetes. We call it metformin. It works on both condition of insulin resistance, diabetes or pre-diabetes, and PCOS. If the main target is to induce ovulation and to achieve fertility, we use fertility medications. Of course, you have to discuss the different treatment options with your doctor, because every medication has risks, benefits, and side effects, and he will help you to choose the best medicine.